Hi, my name is Julia Parker, and today I will be giving a presentation on blood flow through the heart and some diseases that can come with it. When we talk about blood flow through the heart, we will be primarily only talking about how blood flows through the organ the heart and not how blood flows throughout the body. So when we think about blood flowing through the heart, it is best to start with the two different circuits. So first we have the pulmonary circuit and the systemic circuit. I like to think about it like a story with two separate books. One story being the pulmonary circuit and one story being the systemic circuit. So how do we start with this? Well, the pulmonary circuit is blood that needs oxygen. The heart will pump blood into the lungs to pick up oxygen, and then that same blood will go to the systemic circuit to be pumped throughout the body. So now that we know the circuits, it's good that we get a basic understanding of how blood actually flows through the heart. So remember back to my book analogy. That's very important when we talk about the parts of the heart that blood actually pumps through. It goes something like this. First, the blood will pump into the superior and the inferior vena cavas. That is how blood from the body will actually enter the heart. Once it is into the heart, it'll be pumped into the right atrium. Then through the right atrium, it'll go through the tricuspid valve. Remember that valves are used so that the blood cannot flow back to where it was. So once blood enters the right ventricle, the tricuspid valve will stop blood from entering back into the right atrium. So after it goes through the tricuspid valves, it will enter the right ventricle, and then it'll go up the pulmonary valve into the pulmonary arteries, which will pump it into the lungs. Then that is where the blood will actually pick up the oxygen. And then from the lungs, it'll be pumped into the pulmonary veins and then into the left atrium. Once it is in the left atrium, it'll be pumped down the mitral valve into the left ventricle and then out of the heart through the aorta. The aorta is the final stop for blood flow through the heart, and that is actually where blood will start to flow throughout the body. So, now that we know the blood flow, it's good for us to look at the actual diseases that can come from blood flowing. So, atherosclerosis is when plaque builds up on the walls of arteries. It makes it really hard for blood to actually move through it, since it's acting like a plug. It's plugging it up. This can cause many complications with your heart, but it can also cause complications with everyday functions. And in some serious cases, it can cause a heart attack and even a stroke, which can lead to death. So now that we know what atherosclerosis is, it's good to talk about what can cause atherosclerosis. So it's caused by smoking, high blood pressure, and high glucose levels. Many times people who are overweight are more susceptible to atherosclerosis just because bad diets tend to cause atherosclerosis. However, atherosclerosis can affect anyone. So what are some symptoms that you should look out for if you think that you might have atherosclerosis? So chest pain is one of the most common symptoms. Pain throughout the body, since it can affect any arteries. Shortness of breath, fatigue, and even confusion, because when your arteries start to get plugged up, it can prevent blood flow to your brain. So what can you do to prevent atherosclerosis? Well, of course, do not smoke. Get exercise, eat a healthy, well-balanced diet, manage your stress levels, and lose any excess weight. This will help prevent and even help treat atherosclerosis. So I brought up atherosclerosis because the main disease I wanted to talk about today is coronary artery disease, which is when atherosclerosis, which is the buildup of the plaque, gets into your coronary arteries, which are the main vessels that bring blood into your heart. So it's actually kind of scary when these start to get that hard plaque and plug up because it prevents blood flow in your heart. So what are the causes of coronary artery disease? Well, since atherosclerosis is kind of hand in hand with coronary artery disease, a lot of the same causes that cause atherosclerosis will cause coronary artery disease. So again, with that smoking, eating a lot of glucose, eating a lot of sugar, bad diet, and having high blood pressure will cause coronary artery disease. So what are the symptoms? Again, since we know the symptoms of atherosclerosis, a lot of the symptoms go hand in hand. However, there are a few differences. So you do have that chest pain. Vomiting is actually a symptom. Trouble sleeping, and indigestion. So treatments of coronary artery disease that are not those lifestyle treatments that we talked about earlier. So there's coronary bypass surgery, aspirin, which is a blood thinner that can help blood flow through the clogged up arteries easier. And again, lifestyle changes. This is a disease that goes hand in hand with some bad lifestyle choices. So anyways, that's going to do it for me. Thank you so much for listening to my wonderful presentation on types of diseases that hurt blood flow through the heart, and these are my references. Thank you.